we have a list of the different signs, and you and I were talking about it before the show started, the signs and symptoms to look out for, which is so important because sometimes it's really important to get that help immediately when you see some of these signs. Let's walk through these, Doctor. I'll take the first one, periods of rapid eye blinking and staring. We've seen that. I've seen that sometimes in family members in my lifetime.
Mm-hmm. So I'm sure all of you listening at home can look at this list and start to think about people or family members that they've seen having symptoms like this, and not all these symptoms for sure indicate that someone has seizures. However, they could be signs and symptoms of seizure disorder. So periodic rapid eye blinking and staring is something that we do see with complex partial seizures or generalized seizure disorders. Jerking movements of the body, that's what we kind of talked about before with generalized tonic-clonic seizures and myoclonic seizures. Stiffening of the body, that's describing a generalized tonic-clonic seizure where all the muscles and all the extensor muscles in the body all activate at the same time. Loss of consciousness. So there's various causes of loss of consciousness, seizure being one of them, and it's very important to take a detailed history and to understand what may have caused a loss of consciousness episode, possibly seizure, breathing problems, hyperventilating, and so on. Loss of bowel and bladder function. Very frequently we observe loss of urine or bowel control with a seizure, so it's part of our history and something we see commonly. So it's helpful in ascertaining whether this was a seizure or not. Falling suddenly, so we talked about atonic seizures, and nodding of the head rhythmically even could also represent seizures.